I'm Emily Mashak, and you're listening to Tuned In to NoCo, Town Square Media's show that lets you know what matters in NoCo. I'm talking today with Dr. Laura Cheever, the physician and associate administrator for the HIV/AIDS Bureau with the Health Resources and Services Administration, and Antigone Dempsey, the director of the Division of Policy and Data for the HIV/AIDS Bureau at the HRSA, about what it means to be aging with HIV. Thank you so much for taking the time to talk to me today. And now, for our listeners who may be unfamiliar with the HIV/AIDS Bureau and the Ryan White HIV/AIDS program, would you be able to tell me a little bit more about that and your roles within the Bureau?
Sure, I can start. This is Laura Cheever. I'm the Associate Administrator of the HIV/AIDS Bureau, and we administer the Ryan White HIV/AIDS program, which is a national program that provides HIV care and treatment at low or no cost across the country to people that can't afford to get it on their own.
Yeah, and I'm Antigone Dempsey, and I work with Dr. Cheever at the HIV/AIDS Bureau to support data and policy work to support the Ryan White HIV/AIDS program.
Now, Antigone, I know that you are a survivor of HIV. Would you be able to touch on your experience a little bit and what being a survivor means to you?
Yeah, of course. Actually, this year marks my living with HIV for 31 years. I was diagnosed with HIV back in 1990, and I was 22 years old. And so that was at a time when there was very little known about HIV and a lot of stigma, although that does still continue today, but there was no treatment. So a lot has happened over the years. When I was given my diagnosis, I was given 6 months to live. Luckily, I was sent to a support group that actually was funded by the Ryan White HIV/AIDS program. And I was able to find a support group for young people with HIV to sort of begin my journey through that, over the years, I was able to access the HIV treatment that has been made available. It sort of started coming out in the mid to late 1990s. And I'm really alive today because of that. And I am aging with HIV, thankfully so, because of being able to have access to that treatment. That's why I think that, I know the Ryan White HIV/AIDS program is just so important for so many people.
Right. Well, thank you for sharing your story. And clearly, from your story, we've come a long way in terms of HIV treatment. Would both of you be able to expand on the progress we've made, and how are things looking now?
This is Laura. I can start. So, as Antigone said, when she was first diagnosed in 1990, we didn't really have any highly effective medications for HIV. So people were diagnosed with HIV, and over a period of 10 years or so of living with HIV, people would die from the disease. In the mid-90s, we had the development of what they call drug cocktails for HIV, combinations of multiple pills every day that people would have to take on quite a complicated regimen that often made them feel pretty sick. But it let them live for years and years, and it was a godsend for HIV treatment. In the last decade or so, the therapies have really improved. So now that drug cocktail, as people used to call it, is often one pill once a day for most people newly diagnosed, and has virtually no side effects. So someone taking that pill every day can live almost normal lifespan with HIV, for one, which is a huge improvement, and two, really they have effectively no risk of transmitting HIV sexually to someone else. So big improvements both for people with HIV and in the efforts to end the epidemic in this country.
Yeah, and I would just add to what Dr. Cheever said, that one of the other things that treatment provided was also for me the opportunity to be able to choose to have a child. When I was diagnosed, I was told that if I tried to have a child, it would be a 40% transmission rate. And once I was able to access treatment and be virally suppressed, that transmission rate goes down to 1% to 2%. And, and so I'm very lucky to have a healthy 11-year-old, and a family, which was something that I never thought I would be able to have when I was diagnosed. And so that's, I think, another important, piece to the treatment story is that many women with HIV are able to have healthy children and can have that be a part of their lives if they choose.
Right. And going off of that, there is a lot of misconceptions and maybe some stigma surrounding HIV. What do you think are the most common misconceptions that people may have about HIV?
I can start, and then Dr. Cheever, if you want to. I think that it's interesting because I think most people understand that you cannot transmit the virus, through touching and through eating off similar plates, but there are still some places where people don't understand that. I think that there is just this sense that because HIV started within the gay community, also injection drug use, so we're talking sex and drugs, there's just so much judgment and stigma around those topic areas that there is just a sense of shame around it. And I think that has really sort of driven the stigma, sort of underlining that. It's gotten better, but it does still exist. And I know also just people with HIV, internally, we feel it ourselves. We carry it inside ourselves, even if nobody's doing anything directly to us. And so that's been very important for us to address. But Dr. Cheever, did you want to add?
I think that's a great summary. The one thing I would add is I think many people who are at risk for HIV because they're having sex with a partner that they don't know their HIV status, or they're only having sex with one or two people in their lifetime, think that they're not at risk, but HIV is something that happens to other people. Many of the patients that I've seen over time said, I just didn't think this could happen to me because I'm not that kind of person. So once again, getting to that stigma of the other people really lets people put themselves at risk of HIV without really understanding it.
Right. And we're also here today to talk about National HIV, AIDS, and Aging Awareness Day. What do you think our listeners need to be more aware of when it comes to aging with HIV?
Antigone, I can start and then pass it to you. So the first thing is that this is really sort of a pioneer group of people, right? We've never had people on antiretrovirals for 20 years that are now reaching their 50s and 60s and 70s. So that's exciting. We know that some of the chronic illnesses of aging, things like heart disease and kidney disease, occur in HIV at a younger age and more severely. So we really need to be managing people differently. And I think so we need to be thinking about that as people age. And we don't exactly know how to do all those things yet. We're learning as we go. Antigone?
I would just add to that, some of the things that we've been hearing, we speak with community members a lot, and we've been hearing from people who are aging with HIV, is that some people are facing a lot of social isolation, especially those who, lost a lot of their friends in the 80s and 90s. And there is also, sort of this sense of survivor's guilt that happens, social isolation, sort of mental health needs, and I think sort of fear of the unknown, because for many years, people didn't think that they would live this long, and now they find themselves aging and having, like Dr. Cheever said, some of these additional medical issues, trying to figure out longer term plans, especially for people who are gay or transgender, trying to think of, where is an appropriate place to find, long-term care, and aging services. So those are things that we're also wanting to try to help figure out for folks as well.
Right. And going off of that, either of you, what would your advice be for a listener who maybe is living with or has just been diagnosed with HIV? What would you say to them?
Well, I would say what I have always said to people who are newly diagnosed, which is you're not alone and you can survive this and it gets better. I think those are very important messages for people to hear, and they're very true. And I've seen it happen over and over again. And then the second piece would be there are services that you can access. So the Ryan White HIV/AIDS program provides services at low or no cost. And we have those, a Find a Provider site. If you go to our website at hav.hrsa.gov, there's a link there and it says Find a Provider. You can put your zip code in there. And I would say, please find services as quickly as possible, because the sooner you're able to access services and get on treatment, the better it's going to be for you in the long run.
I think Antigone said that there are places you can go for care where people are going to accept you exactly as you are. I think because there is so much stigma, both self-stigma and stigma still in different parts of the healthcare system, that people are fearful about that. So if you go to HIV specialty care, people are there waiting for you and will accept you warmly, openly, and with expert care.
Well, thank you both so much for taking the time to talk with me today. I know our listeners will appreciate it. Is there anything else you would like our listeners to know?
No, I think we've got it. That basically low and no cost care is available for people with HIV in this country. So if you think you can't afford the care, you need to look at the resources within the Ryan White HIV/AIDS program.
Again, that was Dr. Laura Cheever and Antigone Dempsey talking about what it is like aging with HIV. You can find out more and access resources at hab.hrsa.gov.